I love the dogwoods, and when they come out, it's almost a symphony of muted colors and improvement in our collective moods as it signifies the spring and moving into better weather here in New England. Of course, it also coincides with my birthday that happens to be yesterday. We celebrate as this was my 50th birthday, and that's, I guess, somewhat of a special occasion. I guess I'm now officially a half a century old. I'm not one who cares much about birthdays, as I consider them arbitrary points in time. After all, we wake up every day into a different world and hope to make it a better place in our own small ways. And that's certainly a birthday. Earlier today, I went for a ride with my son on my EUC around Boston to enjoy this glorious return of spring. It's good to see the Boston streets busy again as people have taken to the streets. Since we're talking about the passage of time, I took a little break from our ride along the river to share with you a couple of tips on how I communicate the idea of recall and follow-up with my patients undergoing root canal therapy. All right, take a little moment of rest here. I'm sitting here right by the Charles River. In the background, see the skyline of Boston. It's a beautiful place. I love this place. Since the subject of our conversation today is temporal, what I wanted to talk to you a little bit about, as I mentioned before, the importance of recall in terms of our success rate, and putting patients' mind at ease is very, very important. Patients, they want to know if this treatment that they have had done is going to be successful and whether anything else needs to be done and whether all the bacteria has been removed or not. The answer to that question is very simple. It's long-term recall, and it's something that we don't emphasize on enough as far as I'm concerned. Most of us do the cases and then we just rely on the patients to come back in if they have any discomfort or pain. As we know, much of endodontic disease may not be necessarily painful, and so we want to make sure that we have our patients understand the importance of recall so that we can make sure through CBCT and additional imaging 6 months after the procedure whether the case has worked or not. That should be an integral part of the procedure of a conventional endodontic procedure, and we should not forget that because root canal is done and it looks good on the x-ray. It doesn't mean anything in terms of the actual biological aspect of healing of the bone in the area. To that measure, what I do personally for patients is I explain to them this little simple algorithm. 6 is 6, 6. And I'm not talking about the biblical number of the devil here, but I'm talking about 6 days acute symptoms following root canal therapy is within normal limits. 6 weeks chronic symptoms following root canal therapy is within normal limits. And then at 6 months, they should come back and see me for a follow-up radiograph and hopefully even 3D imaging so we can make sure that the area is healing or has healed adequately so that we can move on with this completion of the procedure. Because if it hasn't healed on, we need to go to the next phase of treatment, which would be a surgical addressing removal and curettage of the lesion or finding out why it hasn't healed. Because as we know, 5% of these cases do require surgical revision, and so it's important to know that. So this idea of doing the root canal therapy and then giving the patients this information of having potentially symptoms for 6 days is within normal limits helps at least make sure that the patients are comfortable and they have the knowledge that if they're having any symptoms post root canal therapy, it isn't abnormal. Now, doing proper crown down technique and proper irrigation and length control, you can really certainly minimize the amount of post-op pain they have following root canal therapy, as we've mentioned in previous videos. But following that first 6 days of potential acute symptoms, then I tell them that there's potentially 6 weeks of here and there little twinges and symptoms and so on that could occur, and that's also within normal limits. Because one thing I've found is patients always want to know what is normal and what is not, and what are the within normal limits or not. So to that extent, what we need to do is to assure our patients that what they're experiencing is within normal limits or not, because a patient who doesn't know is going to feel very uncomfortable and very worried about whatever kind of symptoms they have. So this way they understand that if they're having little twinges here and there and some symptoms within 6 weeks following the root canal therapy, is not necessarily a problem. Now, if symptoms are getting worse over time, that isn't normal and they should be contacting the office. But just having some symptoms within 6 weeks is not necessarily abnormal, and it could be part of healing. But symptoms beyond 6 weeks is not normal. So what I would tell patients is that up to 6 weeks is normal, but if you're having symptoms at 6 weeks following root canal therapy, it's not normal, and come back and see me at that point. But if there are no symptoms, the next milestone is what I tell them would be at 6 months. The 6 months milestone is the one that we're going to check radiographically and make sure if everything is healing or not, and that's an important one. That's the one that is going to help you understand the actual success rate of your cases and the patients have been doing well or not and how your techniques are doing. So it's very important to try to get the patients back, and this doesn't really happen through just sending them a mailer or something like that, but it happens through really letting them know at the point where the root canal is done that you do expect to have them back in 6 months to follow up, and it's important to let them know that certain amount of these cases don't heal, and it's important to know so they don't go around with chronic infection without knowing it. Now, the reason I say this is because all of us know, and I deal with this on a daily basis online and on the internet, and some of the videos I've made before regarding this idea of holistic dentistry and root canal therapy not being safe and so on and so forth, that there are a number of people that out there that do not believe that root canal therapy can be safe. And this idea of telling them that you're going to make sure everything is healing by having them come back at 6 months to make sure that if they don't have any symptoms, that also the bone is healed, is a critical part of your continuity of care and making sure everything is done nicely. Another benefit of this is that you can tell patients that you can check the quality of the crown at 6 months and make sure everything is healing and sealing well, which will go overall into the entire process of doing a procedure and feeling the responsibility of following up and continuity of care with your referring sources. And if you're the one restoring the tooth, also just checking the tooth and making sure everything is good. Of course, if you're doing the root canal and you're the general dentist, you would also be seeing this patient for hygiene, but it's critical to, during the hygiene visit, to include that post-op image for your follow-up and recall. So this is all I wanted to talk to you about, this idea of 666 and not the Lucifer's number, rather the number of 6 days and 6 weeks and 6 months that are some of the milestones that I discuss with the patients immediately post-op that helps them understand what's involved, and the importance of continuity of care and follow-up is then explained to them. Patients need to have specific instructions, and that helps them feel more comfortable about the work that they're receiving, as well as your interest and care into making sure that the work that you've done has succeeded and has done well. And if there is problems at 6 weeks, we can figure out what's happening, and if there hasn't been any healing at 6 months, we can follow up at that point and see what are some of the procedures that can be done to mitigate that. We could do that in other videos. Anyway, I just want to keep this short, and I hope this information was helpful to you. All right, guys, see you in the next video.